Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to share with you some exercises that you can start to incorporate around the 4-week mark after knee replacement surgery. As always, this isn't an all-inclusive list, but these are just some general exercises that around 4 weeks in your rehab and recovery, I start to incorporate and start to use with some of my patients. Before I do that, be sure to hit that subscribe button, turn on the notification to catch all of our latest videos. So the first one I want to talk about is sit to stands. So probably at this point you already are performing sit to stands from a chair or other surface. But what we want to start to do at this point in your recovery is start to progress that and make it a little more challenging. So of course we have our regular sit to stand, just going up and sitting back down. How we can progress that, one way is to just do sit to stand taps. So basically you stand up, and now instead of sitting all the way back down, you're just going to go to just feel the chair, and then you're going to come right back up. And come right back up. So what that does is start to incorporate some more eccentric control with that downward portion of the sit to stand. So a little bit more strength, coordination, and control. So that's one way to progress it, is sit to stand taps instead of sitting all the way back down. You can also incorporate some weight. So for example, I have a dumbbell. I can hold the dumbbell in front of me. You can get 2 dumbbells and hold them at your side. However, you want to incorporate a little bit of extra weight. So now doing the sit to stands with that little bit extra weight, you can do the full sit or you can do the taps, just making it a little bit more challenging, building a little bit more strength. You can also perform sit to stands from a lower surface. So if you have the capability to get into a lower chair or a mat table that's lower down, that's another way to build more strength and make it a little bit more challenging. And the last way I want to share for sit to stands is trying to do it with just one leg. So keeping one leg out in front of you definitely requires some balance and stability. You're going to lean forward, come up, and then sit back down. Probably really challenging, especially on the surgical leg, but definitely a good way to progress your balance, your stability, and strengthening with the sit to stand exercise. So there's just some ideas for that one. The next thing I want to talk about is step-ups. So this is another one that you may have started, especially if you're someone who has steps in your home that you have to manage. But I'm going to kind of talk about step-ups as more of a strengthening, dynamic balance type exercise. So definitely have some supportive surface. I have the wall here, but if you can have a railing, something to hold on to for support, definitely a good idea, especially when first trying these exercises. So we have just our traditional step up and back down. To make it more challenging, of course, you can adjust the height, make the step higher, will make it more challenging, require more strength and control. Step a little bit lower, makes it a little bit easier. Now, when we're doing this for exercise, we want to train both sides. So you actually want to step up with the surgical leg and do some repetitions with the non-surgical leg as well. I know when doing stairs we say up with the good, down with the bad, but for strengthening and for exercise, we actually want to try to work on both sides. So besides just straight step ups, if you have a step like me, you can step up and then step down. You can also just do some taps if you're doing it from a higher step. And something that's really challenging that I like to eventually get to is controlled step downs. So you have one leg out in front of you and you're just trying to tap and come back up. This really requires a lot of control and strength. You might need to hold on initially, but this is a great exercise, especially if you're having some trouble with going downstairs, discomfort and trouble with going downstairs. This works on that eccentric control, that downward motion against gravity. Besides forward, we can do side steps, stepping up and down. Again, trying to do both sides. You can do up and over. Again, if you do need that support, I do recommend it, especially when first trying this. And then just like we did the step downs forward, we can do the lateral or side step downs. Again, a really good exercise for strength, balance, and that eccentric control that can really help with going downstairs and other dynamic activities. So these are just some of the things that you can start to incorporate maybe around that 4-week mark. Of course, there's going to be some variability for folks. The next exercise I'm going to show you is lunges. Another really dynamic, functional strengthening type exercise. Again, we want to have that supportive surface in front of you. Ideally, a kitchen counter, tabletop, something very firm and sturdy. You're going to stagger your feet, and you're just going to try to keep your back up straight, looking straight ahead, come down, and then back up. The good thing with lunges is that you can modify how far down into the lunge you go. So probably early on, when you're first trying this after surgery, you're probably not going to go all the way down and touch your knee on the ground. That takes a lot of strength and a lot of good range of motion in your knees. And so if you can't do that initially, that's perfectly okay. Just try to go 25% of that. And if you can do 25%, try to do 50% of a lunge. So definitely recommend doing it on both sides, getting that strengthening benefit, getting that range of motion benefit from both sides. Again, do a range that's comfortable for you. Some other things you can do is add a little bit of weight. As long as you feel balanced and stable, you can stagger your feet and add a little bit of weight as you do the lunges as well. Definitely recommend having that support though, having that therapist or someone who is trained, who can guard you as you're trying that exercise, especially for the first time. So lunges, another great option. And the last one I want to share with you is deadlifts. So we don't super commonly see deadlifts in therapy for whatever reason. I think people think of deadlifts, they think of having a big barbell and lifting really heavy weights. But there's a lot of ways that we can do versions of deadlifts that work on that good hip hinge, strengthening what we call your posterior chain, your hamstrings, your glutes, your back extensors a little bit. So how I like to do it is I get a dumbbell or a kettlebell and I put it up on an elevated surface. So I have it up on the step here. And then all you're going to do, feet a little wider than shoulder width apart. You want to keep a good back position. So you don't want to flex at your back. You want to do a hip hinge. So you're going to hinge, stick your butt back, and hinge at your hips. And then you're going to hold the weight. And you're just going to keep your arms. Your arms are basically like ropes. They're just going to stay long and stretched holding that weight. And you're just going to come up, extend, straighten everything up, and then reverse that back down to the starting position. And usually I'll have my patients do 10 to 15 repetitions. If they're comfortable with that, I'll add a little bit of weight. But really I'm focused on good form. So good hip hinge, keeping a good back position, getting that good flexion and alignment of the legs. So just another easy thing, well not easy, but another effective thing, an exercise to add around that 4 to 6 week mark. Again, it depends really on a lot of different factors, how you're progressing with your healing, your experience with different exercises and activities. But this is just to give you some ideas, give you some things that you can maybe take back to your physical therapist or take back to your trainer or other healthcare provider. And great ways to build strength, range of motion, balance, stability, as you progress in your rehab and recovery after surgery. So again, we talked about sit to stand progressions, we talked about step-ups, forward and side steps, we looked at lunges, and then we looked at modified versions of performing deadlifts. I hope you found this helpful. Please be sure to hit that like button if you did. Please be sure to leave your comments and questions below. As always, thank you for watching.